We're currently in Guatemala for about 10 days. We came with a team of 14 people from Hunterdon Medical Center, and people are from the residency program, so we have 2 residents, 2 faculty, 1 former resident that is now an attending. We have somebody that works in facilities in the hospital, somebody from the emergency room, a nurse from one of the floors on the hospital. We have somebody that's a patient aide from the ICU. So it's really a nice mix of people, and it's created a great team.
My name is Brian Buchanan. I live here in Guatemala, and I do medical and dental work in the remote villages. The reason I say remote villages is that there's a group of people that are Mayan Indians that had to go hide during the Civil War, and so they go way out into the jungle to hide, and they've been there for, well, 55 years now, and many of them still live there.
We are taking care of a lot of indigenous Mayan, so we've had to deal with folks not knowing Spanish. So some villages we've had to have interpreters to Quechua to Spanish, and then an interpreter from Spanish to English for those on the team that don't speak Spanish.
So when I came to Guatemala and found out that these people were living out there in the remote jungles with no medical care, no dental care, nothing, and no one cared about them and they were forgotten about, I decided to move here and do something about it.
We've gone to, at this point, 6 remote villages over the course of the past week, managed to see 1,000 patients, which is particularly impressive when you realize that it takes us at least 2 hours to get to those villages every day.
Every morning after breakfast, we load up the truck and the trailer with medicines and supplies and food and everything that we need, load the teams in, and we drive for 2.5 hours to the remote villages that no one else will go to. So sometimes the roads are a bit rough.
Oh my goodness, how do I feel about Guatemala roads?
Sometimes they're not roads, they're just buffalo trails, but we can pass.
For me, really one of the more inspiring things about this trip has been the enthusiasm of Hunterdon's community supporting this program, from local pharmacists and pharmacies to donors in the community. The other thing that's been really inspiring for me is the enthusiasm of the people who work at Hunterdon to participate in this trip. And it's been such a pleasure for me to work closely with a group of people that I pass on the halls every day, but I don't get to work side by side with.
And it's amazing that for individuals not knowing each other before they came, right from day one have kind of gelled together, and it just picked up and done whatever needed to be done, and it's been really nice.
For the residents, it's an opportunity for exposure to different health conditions. It's an opportunity for exposure to different ages, different patients that we would normally see. It's an opportunity to learn more about medicine and a different kind of medicine.
Some of the purposes of it is to get the residents' experience in working in another portion of the world, really looking at how do you provide care in a resource-poor area.
Yeah, you have to think on your feet, you have to anticipate, you have to have plan B and plan C, and you have to be ready for anything, and you have to be flexible.
So we see kids with ear infections and colds and eczema, and people with asthma, and older people with diabetes and high blood pressure. Certainly we see amoebiasis or parasites and worms, and that's a big concern of the people in the community. So a lot of the mothers expressed concern that their children weren't growing at the rate they'd like them to grow, or concerned that they weren't gaining weight well, or weren't eating well, or complained of stomach pains. In addition, we see more dermatologic problems. In part that has to do with the climate, so you're more likely to see fungal skin infections. We're more likely to see skin infestations because of bugs, basically.
So Heather, what's happening here?
We are removing a cyst. It had been there for 48 years, he said. And we just removed as much as we could, and now we are suturing back up.
If a person doesn't have teeth, or in the case of most of these villages, the teeth are so rotten they're actually down to the gum line and they're full of abscess. So that means they're constantly, their body's trying to fight off this infection. They feel sick all the time, they feel tired all the time, they don't have the energy to do the things that they need to do, and plus they don't sleep because of the pain. So by removing the tooth that's got the abscess, or the roots that's got the abscess, clean that out, put them on antibiotics, and put them on pain medicine. Then you go back and check on them 2 weeks later and you find out, you know, they're crying because they're saying, this is the first time in 15 years I haven't had pain. This is the first time in 15 years I've been able to eat.
The other day we saw a gentleman that clearly had renal failure from his diabetes. We didn't have any CAT scan, we didn't have any lab work, so it was really on history and physical, and kind of learning that you may not need to do all the tests that we do back in the States. And how do you think about what resources do people have access to?
So to learn that you can rely on your own clinical skills and knowledge as a physician is a powerful lesson for students of medicine.
I think this type of opportunity, this type of trip, just reconfirms my notion that I think people just want to live their best possible life, and that we all, no matter what our job title is, can help them feel better emotionally, medically, you know, physically, in any way.
I like to do this every year to keep myself grounded, remind myself of what things are like outside of electronic health records and insurance companies, and when there's just people who are sick and looking for help and looking for some way to make their health better.
Because it reminds you that your primary job is to connect with the patient wherever that patient is, whatever the age of the patient, whatever the gender, whatever the language they speak or their cultural background. It teaches you ways to connect with the patient that helps you anywhere you go in delivering health care.
We feel it has a big impact on the people that we serve here simply because there's no one else to do it. No one else will go that far or that deep into the jungle, and the government doesn't have the money or the resources. So I don't want to sound over dramatic, but if we don't do it, nobody does it.
Really listening to the heart and lungs and really providing that touch and that connection to the patients that they may not get a physical ever.
It crosses cultural barriers for a physician from somewhere else to kneel down on the floor and examine another woman's child, to give the message that we care about you wherever we're from and wherever you're from.
It gets you out of the box. You get to see life in someone else's perspective. It gives balance. It gives back. I know people think we're giving something to these people, but I think it's 1,000-fold I get something back.
There's a lot of people who don't have access to medicine, and I think it's important that we spread comfort and ease suffering in places that don't have access to these things.
I really appreciate this team that came from New Jersey. They took time out of their busy schedule to come down here and help people they don't even know. Now that takes a special kind of person. And so from the bottom of our hearts, me and my wife Marlene are overwhelmed, not just with the fact that they have come and done this, but they've been the hardest working people you've ever seen. These people are up at 5 packing medicines. These people are packing the van before they ever have breakfast, and they are locked and loaded and ready to go before most people are ever awake. And then they're going for 2.5 hours and climbing into a truck and going up into the mountains, and it can be 101 degrees, and they're sweating and they're not used to that, and they're just seeing one patient after another after another. But the other thing is, they all have a good attitude. It's not like they're whining and, oh, it's hot, or oh, this, or oh, that. They're like, let's go. And if I say, well, we got to ride for another hour in the back of the truck, they're like, no problem, let's go. And those are the kind of people we need. We need the people that are like, we're here to serve. Let's get the job done. And I just want to say thank you